Pleasant evening to everyone. I hope that you all are doing well and that you all are having a great day today. This is the last of the webinars for today, and the title is um, mental health for caregivers. And I would like to welcome, to the platform this afternoon, Mr. Allister Sandy. Yes, and I will allow Mr. Blackman to read his biography for us this afternoon.
Okay, so Allister Sandy is the founder and chief clinical psychologist at Sandy Shores Psychological Services. He's an adjunct clinical psychologist at UWI's Psychoeducational Diagnostic Interventions Clinic, PEDIC. His core activities include psychotherapy, mental health, and learning disability evaluation, and presenting on mental health topics. Allister has an MSc in clinical psychology and is a member of the Trinidad and Tobago Association for Psychologists and currently serves at the St. George Central Psychology Department. Now, I want to thank one time the Trinidad and Tobago Association of Psychologists for referring Mr. Sandy to us. You know, we wrote to them and invited them to assist us in having this session, and they responded quite kindly, and I would really like to sincerely thank the association.
All right, great. I will definitely pass on your thanks to them.
Right. Allister, you could go ahead.
You ready?
Yeah. Yes, you can go ahead.
All right. So good afternoon, everybody, all the viewers. All right. And thank you for that lovely introduction. So I'm here to discuss caring for the caregiver, tackling the mental issues faced by those looking after people with severe blood challenges. So I just want to go over the objectives of this webinar. So one, I would like to identify mental issues, challenges caregivers of those with severe blood disorders are likely to face. I want to provide the tools and information for effectively dealing with these specific challenges. And I want to answer questions caregivers may have about related mental health concerns. So what are the issues caregivers face? One, emotional distress, the strain of providing support, guilt sometimes and self-blame, jealousy among siblings, especially in the case of where a parent is taking care of a child with a blood disorder, and some possible mental health outcomes. Sometimes you have increased anxiety, depressed mood, irritability, and damage to social relationships, because as you know, if you're put into an irritable mood, sometimes you may have inappropriate reactions to certain social situations. Mental exhaustion. And I just want to make clear that usually these problems do not present as clinically diagnosable, but they may still be distressing to the caregiver experiencing them and are worthy of attention. So when I say might be clinically diagnosable, it means that the symptoms that the caregiver will be facing may not necessarily meet the criteria for a mental health disorder, but it is still worthy of recognition and attention, even though it doesn't meet that particular threshold. So just to give some definitions in basic terms, so stress is the physiological and psychological response to perceived adversity. Anxiety is the natural response to stress accompanied by fear or apprehension of the future. So what we're talking about here, stress is a natural phenomenon that happens to everybody. It's just a matter of whether you have too much of it and how well you deal with it. And anxiety is basically the feeling of stress projected into about concerns about the future, what something might happen. That feeling of something negative is going to happen, either about something specific or just the feeling itself of something is about to happen that is not going to be positive. And then, of course, we have depression, a mood defined by great difficulty in deriving pleasure from anything. So, for the listeners that I have here, I have a little questionnaire for you all to do, a very short questionnaire. I'll just give you all about 5 minutes to complete. So the whole point of this is I want to be able to, or I want you to be able to identify your current level of stress, right? So I will send a link either in the chat to where you can actually find this particular questionnaire later on. So you can compare your results and see where you are now and where you could be at a later point in time. So go ahead and look at this particular question, and what you could do, the scoring for it is at the bottom. All right. So for the questions 1 and 4, you're scoring never as 0, almost never as 1, sometimes as 2, fairly often as 3, and very often as 4. Now, you don't have to tell me at any point in time what your score is. This is just for your own educational purpose, understanding where you might be at right now in terms of your own personal stress level. So remember, you're scoring questions 1 and 4 differently from how you're scoring questions 2 and 3. I'll tell you what the different scores mean after I'll give you about 5 minutes. Just before we continue with the presentation. I hope you all had a pencil and paper nearby. Mr. London, I will use you as an average point for when people might finish. So if you're finished, just give me a thumbs up.
Yes, well, I did it already, so I would have completed mine.
All right, great. All right.
So, yeah.
So just to give you an understanding of what the scores may mean, a score of 3 and below would be very low stress. Right? A score of 7 and above would be very high stress, and anything in between there would be moderate stress. All right. So I'll go ahead and move on. So let's look a bit at emotional distress. Right? So this refers to worry and concern evoked by the diagnosis of a severe blood disorder in a loved one and observing their challenges. particularly significant where the parent is taking care of a child, because no one likes to see their child in a position where they are suffering. Also particularly distressing when the child has been diagnosed at a young age. So research has shown that particularly with couples, when they have a child that has been diagnosed at a younger age, then they report greater relationship distress. The parent may feel uncertain about the child's future. The inability of a caregiver to cope emotionally with the stress of the person with the illness breaks down their ability to provide care. And we'll touch a little bit more about that in the following slide. So imagining negative future outcomes may bring about anxiety or despair in the caregiver. So just to put it into solid context, into a real life situation. So here is the story of Sarah and Jake. Jake has always been the protector of his younger sister, Sarah.
Okay.
Somebody has to use the microphone. Jake was always, excuse me. Jake was always asked to accompany Sarah to every line, ensured that she studied in secondary school, and vetted every boyfriend she ever had to make sure he was not a good for nothing. She was diagnosed with sickle cell disease at the age of 4, but managed to rarely show much sign of the condition until they were both in their 30s. Sarah's pains have since become more common, and Jake feels more helpless than ever. After her divorce, Sarah lived alone until Jake moved in with her. He often worries about his sister, and the thoughts of what could happen to her seem to confront him all at once when he goes to bed at night. Recently, he has started staying out at night, both so he can avoid the feeling of helplessness when he's around her, and so he will, helpless when he's around her, and so he can fall asleep better. Sarah has noticed Jake's activities and wonders if she has now become a burden to her brother. She wishes he would stay at her side like he used to. So how do we deal with coping with emotional distress, right? So first point is to use positive coping mechanisms and avoid negative coping mechanisms. So a negative coping mechanism is an action done to manage stress that naturally tends to have an unhealthy effect. So just some examples of negative coping mechanisms. We have drug use, excessive alcohol use, excessive sleeping, excessive spending, risky and promiscuous behavior, or completely avoiding stressful situations. So as we could have seen in the previous story, Jake was not properly applying these particular principles. He was using an unhealthy coping mechanism in terms of his excessive alcohol use, and also completely avoiding the situation in terms of avoiding Sarah. So what are some positive coping strategies? So first of all, utilize support groups. You will emotionally benefit from being among others who understand your challenges and are sympathetic. Some may have already gotten past challenges you are currently facing and can provide hope that your situation will improve in the future. Support groups can also provide advice and resources on how to deal with challenges you face. They can reduce feelings of loneliness. So I was very glad to hear that we had a group dedicated to severe blood disorders in Trinidad and Tobago. I actually started following you before this opportunity was presented in terms of helping you out with these presentations. It's very good that people have an outlet and a group of people that they can reach out to. So other positive coping strategies. So make time for self-care. Make time for personal relaxation and leisure activities. It is also helpful to adopt a hobby that you can develop as a skill, example, story writing or playing an instrument. Schedule self-care activities at fixed times where you know you are most likely to have free time. Maintain proper physical health. Get sufficient sleep and engage in adequate nutrition because both of these strategies help maintain energy and help you not be irritable. So also seek help from a professional if needed. So you can consult a certified psychologist or psychotherapist to assist in dealing with your distress if it is that you feel that it is too great for you to manage on your own. So we're returning to the story of Jake and Sarah. So a mutual friend of Jake and Sarah noticed that the two are not as close as they used to be. He confronts Jake about this, and Jake admits he has been avoiding Sarah because he feels useless. Their friend assures Jake that Sarah is glad just to have his company and that he is the best company when he is sober. He also convinces Jake to see a therapist to help him deal with his anxiety over Sarah's future and identify better ways to cope with than drinking. The therapist advises Jake that there is nothing wrong with having a glass of alcohol now and then while relaxing, but that excessive drinking will damage his relationship with his sister. He instead advises Jake to take up story writing again as a way of self-expression. This turned out to be a good idea as Sarah loves listening to Jake's stories. So another challenge that caregivers face is the nature of support required for their dependent. So the person with a blood disorder may require a high degree of monitoring, reducing the caregiver's ability to work outside the home. This may create financial strain in the home. This may be added to by medical costs. Time demand on care may also restrict the caregiver's social life or duties to their family of creation. So this is particularly relevant in cases where sometimes your sibling may be suffering from a severe blood disorder like sickle cell, and you have your own family to take care of. Maybe you would have just introduced children into the world, and now you have to sort of divide your time into also taking care of members of your original family. And then, of course, there's physical burnout and the unanticipated role reversals in certain cases. So when we say things like unanticipated role reversals, you'll see an example of what we are talking about here. So let's move on to the story of Donna and Ronnie. Donna has been a happy housewife for the past 6 years after the birth of her 3 children, ages 6, 4, and 2. Her husband, Ronnie, has always met her needs financially, working as a construction worker. Recently, however, his sickle cell disease has become far more serious, making it impossible for him to work. Donna has never had to take care of her husband before, as he has always been fiercely independent. Without a household income, Donna has been forced to take up an odd job as a preschool teacher. She finds the ordeal of taking her own children to school and daycare, taking care of more children at school, and then returning home to take care of her family again to be incredibly stressful. She used to be able to go out with friends when her children were out or on weekends when her husband was home. Now she can barely pay the bills and feels exhausted constantly. So how do we deal with this particular issue? Right? Dealing with the difficulties of care provision. So one way is to communicate with the Ministry of Social Development and Family Services to see if you apply for a form of government assistance. So that is in cases where you may need some type of financial aid, you can communicate with that particular ministry and have a discussion with them and try to find out what they can do to assist you. You can also communicate with community support groups Example, places of worship, NGOs, etc. for assistance. Once again, self-care is important to avoid burnout. Also, have a medical practitioner evaluate your dependent to gain an accurate picture of your limitations. Allow them a level of independence in keeping with the medical practitioner what the medical practitioner has indicated. This ensures that you do not overly shelter the individual and take on too much responsibility on yourself. So this is something we sometimes see where, especially in parent-child relationships, but in others as well, where a family member is diagnosed with a particular issue or challenge, and instead of providing accurate level of assistance, they tend to go sometimes overboard, and they don't seem to fully appreciate that this particular person could still do X or still do Y, and it's not necessary for them to go the 4, 5, 6, 7 extra miles because the person is still capable in certain instances. So you want to get a person evaluated by a professional to say, okay, this should be safe, maybe we should hold off on this particular activity at a particular point in time. So let's go back to Donna and Ronnie. So Donna decided to discuss the issue she was facing with her religious leader. Seeing that she was in honest distress, he informed her that their place of worship put things in place to financially assist members of the congregation who needed it. In addition, a member of the women's branch of the institution volunteered his services in transporting Donna's children to and from school, since her son also attends one of these schools. This greatly helped in reducing the workload Donna faced daily. So what do we do about issues of guilt and shame? So occasionally a parent may blame their choice to have children with a specific partner without checking to see if they carried the sickle cell trait. They may feel like others are judging them to be bad parents. They may even assume that the child may grow up to dislike them. Feelings of guilt can undermine the parent's confidence in their own ability to make decisions, making them appear indecisive. They may also feel the need to compensate the child by not applying appropriate discipline. Healthy siblings may also feel guilt that they have been spared the condition their loved one now faces. So let's look at the story of Hannah. So Hannah's 7-year-old daughter was diagnosed with sickle cell disease when she was just 4 years old. Apart from feelings of helplessness and worrying about her daughter's condition, she feels personally responsible. Despite considering herself as picky when choosing a husband, it never occurred to her to screen for conditions that might affect their offspring. Now she feels as though she could have done something to prevent her daughter's illness. She often wonders if her daughter will come to blame her for her medical condition and is very anxious about their relationship deteriorating in the future. In her feelings of guilt, she often tries to compensate by being very lax in disciplining her daughter and often spoils her. So, how do we deal with feelings of guilt and self-blame? So, first of all, evaluate the usefulness of this line of thinking. If you find yourself engaging in self-blame, ask yourself, how does this improve my child's situation? What impact are these thoughts having on me? And if thoughts are having a negative impact, how is it affecting my ability to provide care? So just to make a distinction, you will see the topic dealing with both guilt and self-blame. So guilt is defined as a feeling or emotion, while self-blame is an actual activity. So some people might feel guilt, but when it comes to actual self-blame is negative self-talk, criticizing themselves, internally, externally. That is what will constitute self-blame. Also, you want to focus on the present and what can be done to improve the situation. Break up challenges into smaller specific goals. Tackle those goals one at a time and acknowledge when you make achievements. That particular point is very important, that last point there. A lot of people don't acknowledge when they make even minor achievements are still achievements, and you may deserve credit for making those achievements. That encourages you to do more. So keep a journal about your dependents' positive experiences and your positive contributions to their life. Example, I bought Charles pizza today. It was his first time trying it and he really enjoyed it. And you want to be able to also not just write in it, but also go back and review what you have written in your journal if it is that you are struggling with these feelings of guilt. Do not mind read, assuming you know that your child blames you for anything. So this is something we also sometimes encounter in clinical practice where one party believes that the other party is blaming them for something. And it has never even really crossed the other person's mind. They never even bother to ask or bring it out in the open, do you blame me for this particular situation? They just assume that the other person at the back of their mind is holding them at fault. Right? So let's revisit Hannah. At her daughter's parents' day meeting at school, a teacher complained to Hannah that at times her daughter would complain about chest pains to avoid doing work in class. The teacher saw no obvious reason for these complaints and was convinced that her daughter was faking. The fact that Hannah's daughter was relatively irregular with completing homework, etc., cemented this idea with the teacher. Because of Hannah's worry about how she would be perceived as a parent, she never informed the school about her daughter's medical condition. Hannah realized that she had been so focused on what might happen, she was not paying enough attention to what was happening. She vowed to correct this mistake and began by informing the school of her daughter's condition. She also focused on addressing her daughter's failing grades and ensuring she did her homework. It turned out that her daughter grew to respect Hannah greatly and never seriously considered blaming her parents for her health. Mother and daughter maintained a healthy relationship for decades. And this is the final issue that caretakers often have to deal with when dealing with people with, or taking care of people with severe blood issues. So children may become jealous of their sibling with a blood disorder due to the level of attention their parents pay to him or her. A child suffering from a blood disorder may also become jealous of the freedoms of their siblings and feel relatively restricted by their symptoms or by the safety precautions placed on them by their caregiver. So let's examine the story of the Sampsons. So Bart is annoyed at his 5-year-old sister and their parents. Why do they both have to go to the doctor's office with her? Ever since she was born, the attention of his parents seemed to completely shift to her. He understands that his sister gets very sick sometimes, but in the end, she always feels better, so why make a big fuss? The news that he had just passed for his first choice school was immediately overshadowed by one of his sister's episodes, and he was told that he was a big boy now and could stay at home for a bit while he took his sister to get treatment. Bart feels left out and irrelevant. He goes to his room to play video games. When the rest of his family returns, he refuses to come out for dinner, saying that they should just give his sister his share because they clearly like her more. So how do you deal with managing jealousy among siblings? So when one child is jealous of the attention of another, or that another is getting, if the child has expressed this to you, thank them for being open and honest. Tell them that how they feel about the situation matters to you. Reassure them that you do love them as well. Explain to them that your other child's health concerns are the reason for the unequal attention. Make sure that they understand this. Give them a role in your other child's healthcare to make them feel involved. For example, giving them the task to remind you when your other child's medication is due. Further on managing jealousy. So when a child is jealous of the freedom of a healthier sibling, have them medically evaluated to ensure that restrictions are necessary. So this goes back into the point we discussed previously, to make sure that the restrictions that you place on the child are valid, that they are actually able or not able to do specific things, or this particular activity is safe for them, this particular activity is not safe for them. So you don't end up over restricting the child. Explain that certain restrictions have been placed on them for their well-being. Expose them to a diverse number of safe activities such as art or musical instruments. You want to be able to make sure that they still see avenues in where they can be active. Ensure they have an activity that is also a skill that they can improve at, master, and build their own self-esteem. So Sampson's continued. Mr. Sampson, realizes that his son is angry with them and asks him to explain himself. Bart expresses he believes his parents always run off to do things with his sister and stopped caring about him. Mr. Sampson doesn't like the boy's tone, but remains calm. He admits to Bart that he might have a point in terms of how often they run off on him, and is glad that he pointed that out. It makes sense that he would be angry. Mrs. Sampson, however, reassures Bart that they leave together because she cannot drive, but is better at understanding what the doctor tells them than his father is. He had assumed that Bart will get bored waiting with them at the hospital, and that's why they never took him along. She explained that it would be great if he did want to come, because both their father and herself always forgot to bring along things. They needed to wait. And it would be great if he could help them get organized when leaving. He especially forgot to bring snacks and needed him to pick out things they all might like. So just some takeaway points, right? So caregivers for those with blood disorders may encounter issues such as worry, guilt, loss of income, energy, and time-demanding duties, jealousy between their children. Right? These issues can impact on mental health, causing anxiety, depression, irritability, and mental exhaustion. The caregiver can better cope with these issues by taking care of their physical health, reserving time for self-care, utilizing support groups and professionals, and evaluating their thinking around feelings of guilt. Jealousy between siblings can be mitigated by communicating with their children and involving them in each other's well-being. So I hope you enjoyed the presentation. This is just my contact information in case anybody has any further questions or concerns, and a list of the services that my agency provides. I guess if anyone has any questions.
Mr. Sandy, I would like to pose a question to you. I guess I can get the ball rolling. Oftentimes parents, we find different ways of coping with stressful situations. There's some that would avoid, do avoidance. There's some that would repress emotions, and there's some that will do things or use substances that would numb what they're feeling. And they've done it for so long, all the way back into childhood. What would you say to a parent like that who's grown accustomed to dealing with their emotions in a particular way, and now you're presenting that I should have positive ways of treating with it?
It depends on where that parent is what stage of realization. So if that particular behavior that the parent is engaging in, if that is something that is obviously having a negative impact, does that parent realize that the way that they are using to cope is having that negative impact, or are they in a form of denial in terms of, no, this is not having a negative impact, I am just doing X or Y, this is not excessive. So in a particular case like that, what you want to do is you don't want to try to, well, first of all, in a case where you do realize that they need assistance, right? If it is that they've been struggling with that particular coping mechanism, that negative coping mechanism, and they haven't been able to do it on their own, you can encourage them to seek professional help. That would be the best, because if they've been, especially if they've been doing it for a particularly lengthy amount of time, it's going to be a habit that they're going to need time to come out of, right? And the best way to do that is to get professional help consistently, right? In cases where the person hasn't acknowledged that particular aspect yet, you have to approach it in a very cautious manner, in terms of you bring it up subtly, politely, but you don't want to bring it up in a confrontational way, in terms of, look what you're doing, this ain't working out, etc., etc., etc. You want to highlight it to them, suggest it in a very passive way, and just probably take note of it, in terms of when it happens, you highlight it in a very diplomatic way. So I noticed that you came home drunk last night. Right? I do understand why. I don't think that would be useful in this particular situation, in terms of how are you going to be both drunk and manage your particular responsibility as a caregiver. We're just going to highlight that particular issue. But at the end of the day, people have to be able to be aware of themselves and come to help. Right? So a lot of cases like this, what often happens is the person has to come to that realization in and of themselves. A lot of the time, sometimes they need to have a negative experience resulting from how they've been coping. But in cases where the person is already aware that, yes, this is a problem, professional help might be required.
So everyone, the floor is open for those who may have questions, concerns, probably a comment that you may want to make. Yeah, Mr. Sandy's here. Feel free to unmute your mics or raise your hands, and we will take it from there.
I want to urge attendees to, well, raise your hand, all right, and we will come to you. We'll allow you to speak and ask your questions.
Don't be shy.
Oh, Mr. Sandy, I mean, well, you touched on a lot of issues, and for me, sibling jealousy was one. Growing up, especially when I was younger, I guess I would say that I got a lot of my parents' attention, and my brother was jealous of that, but yet I was jealous of him because he won scholarship, and to me he always had my father's admiration for things like that, and I always had to meet a standard, right? But yet I was behind because I was sick and things like that, So I'm glad you brought up those issues, because those issues definitely exist in our society. I see Julissa has her hand up, so I'm going to allow her to talk.
Okay.
Hi, good day.
Good day, good day.
Good day.
Well, I recently had found out that my twin boys have sickle cell, right? Late last year. And everything is just new to me. Still trying to cope and getting safe that they have sickle cell. I came in late on Zoom, but I got most of it because they have an elder brother, whereas he do see the jealousness, so they try to explain to him, and I guess he now coming to terms that what his brothers have, because he don't have sickle cell nor arthritis.
Mhm.
But I'm grateful for the session, and I got the information that I came in. I got it was understanding. So I just want to say thanks.
Glad I could have been of assistance.
Okay.
Thank you so much, Jelsa, for your question. We have a hand, the Society for Inherited and Severe Blood Disorders.
Hi,
Feel free
good
to
night.
unmute your channel.
Good night.
I just wanted to add to what Kieran was saying. Apart from sibling jealousy, I think also some feelings of resentment in terms of the well sibling, like, okay, in my instance, being given more responsibility or, having to do more chores and that sort of thing. Over time, we didn't realize and they never voiced it, but there could be some feelings of resentment. So what advice would you give to parents in that case? I don't know if it was touched on before. I'm sorry if it was.
Let me just make sure I understand the question. This is feelings of resentment that one of the
Right.
healthier sibling has, that they had to carry a larger load of chores or responsibilities in the home.
Right, yes.
All right. In your particular case, was it explained to you exactly why this was necessary?
No, but I am the one with sickle cell, so it would be my sibling who went through that. So,
Okay.
yeah.
Were you aware of what was the communication like between your parents and the sibling?
No.
Because sometimes it may be a lack of communication in terms of the parent doesn't fully explain why why the situation is the way it is. Um, I would like to know a little bit more about the specifics of the incident, but sometimes it may be communication issues. What is the age difference between you and your sibling?
7 years.
7 years. So they are 7 years your senior.
Yes.
And when would you have picked up on this resentfulness?
Only probably in adulthood when, we were chatting and it came up. And I was like, I was shocked because I was like, wow, I never realized that.
But it is good though that you all had that conversation and it's out in the open now. Do you all maintain a good relationship now?
Yes, yes.
All right.
But I'm just, it'll be good for parents to be able to recognize that is happening at a younger age. When it's actually before it actually gets to a point where it damages the relationship between the siblings and so on, or even with the parents.
Parents have to be aware that this is happening because first, well, that's really a key point in and of itself, that during these particular types of webinars, a parent may not have been conscious that they were unfairly or could be perceived as unfairly partitioning the household, the workload of the household. So it is hoped that if someone is looking at this and it ring a bell to them, I wonder if that is something that my children are experiencing, and that we could probably have a conversation about that. And hopefully that would head off any particular long-term impacts of that difference or disparity in how the children are treated. Because like in the example that I gave there, the parents had a different concept in the story of the Samsons. The parents had a totally different concept of what was going on between the children. But so it as the parents always taking their sister and leaving him in the room, while the parents just simply assume that Bart would want to be involved in that particular situation. So there was a whole area of miscommunication there. So it is important now, hopefully, with people getting this access to this webinar, it will be a point of awareness where they can look for these particular signs of these particular things happening between their children.
That's great. We have two hands up, so I'll go with Stacy first. All right. Stacy.
Hi, good afternoon, everyone. I think
Yeah.
that point is really valid because even in my situation, me being SS, and it's only recently as well that I think we possibly, and even my parents, my mom is listening with me,
Mhm.
take it for granted that siblings don't, they feel unappreciative, they feel alone in many situations, and that all the care or the attention is
What are you doing over there?
given to that child that has the blood disorder
Mhm.
and is only possibly like with Renee's situation, years after the situation, that you realize that hey, this was an issue, but it wasn't dealt with. And I think that case study that you did with Bart, where even though he was angry or whatever, the parent was calm enough to know, okay, let's talk about it and listen to him,
Mhm.
as well as even include him in the whole process, because that way I think it will bring the especially if it's like younger siblings and so into caring for the individual. Because with me, I had three siblings, one recently passed, and I know that out of them, there were two that I could have counted on even more than the other one. It's not to say that he would not have been there, but there was just I don't know, a greater interest in assisting when I needed assistance and that sort of thing. So I think communication is really integral in dealing with these situations. Parents might think that their children are too small to understand, but
Mhm.
if you could find the words to just explain it to them so that they will know that it is not that we don't care about you or we don't love you, but this is a situation, your sister or your brother is really, really ill, and this is how things need to be, but we need your assistance as well. Because like in Bart's parents case, parents will feel overwhelmed when you have to deal with going to hospital, rushing to hospital because your child is ill, and you can't do anything for that child, and you're watching your child before you, and you don't know what to do. So in many instances you forget about the rest, and not intentionally so, but you do. And bringing up that point, I really do hope that even though parents who have multiple children with at least one person with sickle cell or whatever, or any disease or any chronic illness or whatever, they will still bring the other children into the picture and actually make it a family affair, one to not cause any resentment, and even to build those relationships from really, really young. So thank you very much for pointing that out.
Yeah. And you
Yeah.
made a very good point that sometimes parents underestimate, not underestimate the need to have that communication with their child, because even I could be a personal example of that. My mother had sickle cell, right? And I didn't know until she got very, very ill. And this was like I was at this was my entire childhood into teenage. I didn't know. I wasn't aware of this. This is just not something that she spoke about to me. And that in itself might have had, if I had known that at that particular time, that might have affected our relationship in different ways than it did, and had different and more positive outcomes.
All right. I'll let Tony talk, and then we have a question, right?
So,
Tony.
Good afternoon, everyone.
Afternoon.
I I'm going to make a comment coming from the point of view of being a parent of a sickler and non-sickler. Well, the other one has a trait, right? But the sickler is 10, and he first presented when he was 2 with hand and foot syndrome. But even between 2 to 10, he has never had a crisis. But we always knew that, well, when he was 6, we got a full diagnosis, right? So, but it's within that space, we always knew how to treat him, how to deal with him, what to prevent, and we didn't just we didn't just have him alone on the prevention. We had both children on the prevention. Because when I remember when I was growing up, I used to be sick often, but with my other siblings, my mom didn't have me alone on the prevention. The thing that I couldn't get involved in, well, so be it. It didn't bother me. But she had everybody on the same regime. Right? So no one was left out. Everyone understood what was going on with me. And even with my son, my daughter understands what's going on with him. And well, he was recently hospitalized, I could say for the first time with a major crisis. And when he came back home, while he was there, she was kind of in a quandary, kind of couldn't understand what's going on. So I had to sit her down and explain to her what's going on. But now that he's out, what I am planning to do is put both of them to sit down together and explain to them what just happened and how we are moving forward. Because he has something what they call pica, where he eats non-food items. And more than likely, we believe that is what threw him into crisis. Right? So now I have to sit both of them down and explain to them what just happened and how we moving forward to prevent it from happening again. Now, when he came out of the hospital, his sister gave him 2 taps and said, I don't eat in sponge again, because I threw one in the back of the hospital. But he just think it as a joke. Huh?
Sister gave him what, sorry?
2 taps.
Oh, okay.
2 taps, yes, and tell him, I don't want to eat in sponge again because I don't want to end up in hospital because they recently lost their dad. And she was like, I can't lose my father and my brother within a year, so try your best and behave yourself. But that's just how we're doing it. I just working with them. They both understand what's happening. They understand what's happening with me. They understand what's happening with him. So we all working together. And I think once parents work together with the children, don't forget the children are too young, they will understand exactly what is going on. They'll understand what is going on. They will ask questions, answer them as best as you can, and just take it bit by bit. If you don't have the answer, at least take a note of it, look it up. Google is there, doctors are there. Together, you could work and keep a strong relationship and a strong thing going, and a healthy one as well.
Very true.
I'll just read the comment here. It's a comment that KW made a comment. In early life, all things were administered equally, including discipline. One inequality was group events away from home were allowed later in life. It's just a comment, that's it.
Okay. Okay.
Anyone else wants to share?
So Sandy, I want to. Okay,
Hi.
go ahead.
No. Sorry about that. One thing I wanted to because this is a caregivers forum and my mom is listening with me. Again, it is not your fault. It will never be your fault that this happened. It's just a chance situation. And I know parents on the whole, generally, you don't want to see your child suffer. You can't even bear it. Because I remember when I was in my pain, my mom's expression was like she was in my pain and going through what I was going through. And I could just imagine what it was for her back then, especially. But one thing I do know that I never regretted being born. Even though, you know, many people say that persons with traits, they shouldn't have children and whatever. I think that's a really hard choice because, I mean, imagine if we didn't have Kieran because his parents think this whole thing and his push behind these webinars and stuff would have been non-existent. I think we would have been at a loss. Right, so that's how I tend to look at these things, situations. Yes, it is very unfortunate that we have to go through these situations and circumstances, but I do not regret it. And for parents and caregivers out there, you are definitely not to blame at all. Thank you.
I appreciate you sharing that.
Thank you very much for that, Stacey. Johansi has his hand up, so Johansi?
Hi, you all hearing me?
Yes.
Yes.
Yes, I'm just responding to what Stacey said because that is a reality. I think the parents' guilt and the caregivers' stress. What she did say in terms of I think sympathizing in terms of the pain is very real. Because I would say I've been through it. My daughter has sickle cell, and being next to her while she is in the hospital, she is obviously in pain or discomfort. It's in some instances, even when you fall asleep as the caregiver, you feel the pain, and then I mean, Stacey, yes, also I think we have to learn how to deal with that or go through a process in terms of dealing with the guilt. Even though that you did say, yes, it's a chance occurrence. I mean, obviously, we did not know that both of us had trait, and as a result is why my daughter has sickle cell. We didn't actively decide knowing, but it is something that I think that I'm still coming to terms with. In terms of, okay, this is something that I would have handed to my daughter because of my genetics. Maybe our guests could speak to that in terms of coping mechanisms to help you come to terms with that faster. I'm trying to come to terms with it. I feel as though I am coming to terms with it. But even in terms of every time that there is a period of discomfort, you kind of regress because again, it's something that is very real in front of you and you have to deal with that. What would you all say about that?
Okay, so one very important thing to always keep in mind is that don't underestimate the human capacity to be adaptable in particular situations. There are only two conditions that people don't adapt to in terms of when they do evaluations on people suffering from different illnesses, even people who have quadrupeds or partially paralysis, fully paralyzed, that kind of thing. They track them over time and they track what they report as their own personal well-being. It always tends to go back up to the standard, even in severe cases. The only two cases that it doesn't normally make that adaptive spring back up is in cases where there is constant pain, conditions that are constantly, where the patient is constantly in pain, and conditions, variations of depression. Because the nature of depression is that it basically sucks the joy out of things. But in other cases where people would normally think that somebody would, after a period of time, start reporting similar well-being to people who are healthy or don't have face the same challenges that they do, that always tends to happen. So don't have the idea that, don't take that particular moment or that particular fact that your child is currently having a particular challenge in this particular moment and extend that across the future to foster that guilt in terms of, oh my gosh, this is how it's going to be, and I am responsible for that. That is, the science shows that is not the typical progression of how these things happen.
Yeah.
So that's just a factor of the matter there in terms of that. Right? And as you yourself would have heard other people stating their own experiences in that regard, in terms of their relationship with their parent. Now, another thing is that you want to be able to make the condition or make the situation as best as you can possibly, and remind yourself that the feeling of guilt, accept the feeling of guilt, it may come naturally, but also focus on what you can do to make the situation better. Right? So you would have discussed that in a particular story where with I can't remember the name I gave her, but with the Hannah and her daughter, right? So how Hannah was handling the situation before and how Hannah handled the situation afterwards. Hannah learned that, okay, regardless of how the situation is right now, I need to do X, I need to do Y, I need to do Z to make the position better, not worse, right? And we call that generally in psychology, we call that refocusing. So instead of dwelling on that particular negative aspect of it, we focus on the positive. Not just for your well-being sake, but you as the caregiver, make yourself a better caregiver by applying a more problem-solving approach to that particular instance.
I want to give a message to the parents, to the caregivers on the forum here, especially those who have that little feeling of guilt. Because I mean, from my conversations with others, and even for myself, most of us, we don't blame, or we don't feel bad that we have this condition that we live with. We learn to adapt, right? But especially in instances where you didn't even know you had a trait, because many people don't know the gene exists inside them because it's silent, right? We cannot blame you, right? So there's no reason necessarily to have a feeling of guilt, right? And I understand it because I have seen my mother probably when I was going through some of my most difficult times, especially I had a stroke, right? And during that time, I guess that was one of the most difficult times for me. And I mean, I saw, you see the guilt on their face, right? But yes, these events happen, but it's not your fault, right? And sometimes, as Stacey said, you know, some of these things happen for a reason, and despite everything I've overcome, and I've become a passionate advocate, right? And yes, perhaps that's one of the things that has driven me to do some of these things, right? And Mr. Young is the one who last year really introduced me to this idea of having a caregiver forum. He had one last year, and he said, look, let's just sit down and listen, right? And you know, we listen from a different perspective and heard the views of caregivers. And perhaps sometimes it's useful that after we as the warriors or the patients listen to what they have to say, that we give them feedback. Because at the end of the day, we love you, and you took care of us, and you brought us as far as we have. That's my message.
I wanted to make a comment as well, or contribution. You know, just over 2 years ago, I would have lost my youngest brother, to sickle cell or complications with regards to sickle cell. And I felt like, we as a family, we never had a conversation about death, and, since that time I would be on the group and, every once in a while you would hear someone passing, and parents are sometimes afraid to have that conversation, because it is likely, and he would have been in and out of the hospital over the years numerous times. And so when he went in that time, it was just like a normal experience that you're accustomed going. But that time he didn't come out, and I felt like there would have been so much more value to us as a family having conversations, about that, not being morbid about it, but that it is a reality, but that we are not afraid to face it should it come, and that, we are there and we are able to support each other, should any consequence come down the road, and I don't know, for some of the parents here, it may be something that you may not, have conversations about or even want to think about, but it is something that I think should be said and should be a conversation that should be had. Are there any other questions or comments or thoughts?
I just want to remind people to also, if you do find yourself struggling with that particular issue in terms of guilt and stuff, remember the journaling exercise that I recommended as well. Basically, what you're doing is you're writing down all the positive instances or contributions you would have made to that person's life, and you are occasionally rereading it when necessary. Well, that's not generally rereading it. But sometimes it benefits to have that outlook in terms of reminding yourself that you are a positive contributing force in this person's life. And sometimes people, because of just how the mind works, sometimes you tend to pay more attention to negative than positive.
So Sandy, there's a question in the chat.
All right, now I'll say it because you may not understand. So Mr. Sandy, what we decided to do was to have a watch party for the caregivers later to watch the movie String. So Mr. Young is asking if you will join us tonight for our watch party.
I can't promise, but I may pass through.
Okay. Well, I will share the link with you when we're through here. All right.
Also, let me just remember to share the link. For those who would be interested in just taking note of the question I gave, I just have to put that in the link in the chat box as well.
Yeah. I want to ask Mr. Young to come forward and say something because he's normally one of our most vocal participants. So I'm going to ask Mr. Young to come on, and because Mr. Young always has a message. Mr. Young, you there?
Yes, I am. Hello?
Yes, yeah, go ahead.
Okay, I'm leaving my camera off because I'm not presentable and I'm trying to recover from the day. I was just asking if Mr. Sandy, that's the name, right?
Yes, correct.
Yeah. Yeah, if you can literally join our organization because your life experience and more so your expertise will work really well with us.
No problem doing that.
The name Sandy sounds like it's such a big name.
Yeah. Mhm. Yeah.
And
As
Tobago has one of the high incidence of because of the size of the population of sickle cell disease.
Mhm.
But I'm sure you would realize that this is an IBD organization, inherited blood disorders, and there are 3 more.
Yeah.
And therefore these challenges will go across the board.
Mhm.
So whilst we highlight sickle cell today, we are mindful that there are others who would have. I mean, we've had deaths in almost every IBD this year. I can think about deaths in thalassemia, hemophilia, and sickle cell disease this year.
Yeah.
So that's just one category of the concern. So now that we've understanding that caregivers, as Mr. Blackman mentioned, have that possibility of wondering how we feel about them. I live with the condition. Thank God I had 2 amazing parents. I say have because my dad, while he's passed, still influences my life a lot. A lot of what I do now is because of them. And sometimes their intuition blinds me literally because there's no way to explain why they do the things that they do or did the things that they did, because those things in the past are still function in my life. I mean, I'm over 50, and as Stacy, who spoke earlier, mentioned last evening, that her parents, her mom more so, gave her stuff to eat that she couldn't explain. Now she has to thank her mom, and she's wary of telling her mom thanks because her mom will say, "I told you so." I have had that same experience, and in our nutrition session yesterday, it was read out where one of the things my parents did. I really would love to understand how they came up with that. Really has good base for nutrition and supporting good health. So, we need to keep telling our caregivers, because we expect them to understand, but we need to say to them as well, the things we feel especially good about them. And I want us to say to say to the community who live with the conditions that we may think it, sometimes we articulate it, or sometimes we do both. In a sense that we say, it's about me. My pain is not about you. I'm the one who's in pain. Why would you feel so badly about it? But all the things that you all talked about would explain to us why caregivers have a challenge. And then I don't know, I didn't hear everything tonight, but our community can become very quiet. So for us to speak out in environments like this is very notable. I am the greatest culprit of staying quiet. So I just want to say thanks for being here and to remind us that caregivers need the ability to feel however they feel and to be forgiven and to be loved fit as well. All right, guys.
Thank you, Mr. Young. And I wanna ask one of our elders as well, Mr. Esdil, to speak, because I'm sure he would have heard things today that would have impacted him as well as a caregiver, as a more senior caregiver.
And as a man, yes.
Mr. Esdil?
Yeah.
I just want to say that that's my dad, who Kieran introduced to speak, and I just want to say that as I as well never had any feelings of guilt. It never even crossed my mind. And especially, I think the fact that your parents, well, my parents were there and very supportive and made that extra effort to seek the knowledge about the condition and, enforce that all throughout growing up. That made a huge difference. So I think parents can be encouraged by that. Parents of children with sickle cell and the other conditions. He probably won't want to come on and say anything.
In the background. All right, we have two I think we have two questions here. All right. Oh, that was yeah, KW was saying, and KW, I think your first one went. All right, and become a member. I think that's directed to you, Mr. Sandy. He's telling you to become a member. We need your life experience and expertise.
Yeah, definitely. That you can count on.
All right, so Mr. Sandy has put the link in the chat for all those who were asking or who were looking for it. All right, so feel free to copy it, click on it, all right, save it to your browser.
Yeah, just a way of identifying if you are at a high level of stress relative to the population and if you should perhaps seek additional services or care to help you manage your levels of stress.
Okay. Mr. London, you have anything else you want to add?
Oh, nothing else on my end. Nothing else on my end. Mr. Sandy, we just want to thank you for your time and availing yourself, to be here this evening, and sharing with us, in terms of your based on your knowledge and your expertise. I'm sure that there are parents here that would have benefited, and we really, really appreciate you coming on and taking the time to come on here this afternoon. Yeah.
My pleasure, man.
Yes. I'm just seeing the messages. Less than 3, low stress, 7 and over, high stress, 4 to 6, moderate stress. And that is for those that would have done the assessment in the presentation that Mr. Sandy would have shared, a way to assess yourself. Where am I at, with regards to my state of stress right now in my life. Yeah.
There's also a longer version of the instrument that is also available for you online. Just more questions. I just didn't want to use that one in within the presentation.
Yeah.
There's a question from Mr. Young. Can Mrs. or Mr. Esdale create a caregiver team of persons interested in learning from their years of success? I guess that is a question for the Esdales, with regards to a caregiver team, and I know that they would benefit, a team of persons like that would benefit, because you get to hear from the experience of those that would have done it, those that are in the midst of it, and you can apply that to your own families.
Yeah.
Yeah.
But I must say, I think one of the questions we asked today was, if for instance, peer support groups could be helpful, right?
Definitely.
And Professor Hutchinson was suggested that yes, that is something that the society could look at, right? So that's one of the things that we have to engage them on in future in terms of help and guidance, in terms of setting up a system like that.
I think well, in terms of, I'll go out on a limb here and speak for him a bit. I think he has never turned down that offer of if anybody would want to reach out to him to, just to chat or to get advice. I think he was always been publicly open about doing that.
I will say from my experience, definitely yes. From day one, when I became a little more active in this organization, I must say that I was welcomed open arms by Mr. Esdale, and always had his support for my ideas and what some of the things that I thought that we should do and things like that, you know. And he has always been one who has been pushing others in the background to do the work on the ground and get things done. He's always made himself available.
So there are no more questions?
At the moment, no, I'm not seeing any more questions. Anybody has any comments to make? Raise your hand if you want to say anything. Make any comments, ask any questions. We don't get these opportunities often, so. Ms. Campbell.
I am reachable on my Facebook page, Sandy Shaw Psychological Services, if by chance somebody has a question or a question afterwards.
I just want to thank Mr. Sandy for volunteering to participate and join the session with us, because it wasn't, it's not that we reached out to you directly, we reached out to the Trinidad and Tobago Association of Psychologists, and you were gracious enough to volunteer, and we appreciate that.
No problem.
Okay, so we just want to remind caregivers who on the caregivers who on the chat now. We're gonna have a watch party to watch the movie Strain, right? Which is about a family discovering that one of the children has sickle cell, and a lot of events transpired subsequent to that. So we want to encourage you all to join and watch, right? And I think it would be a quite interesting movie for the situations a lot of us face here.
Somebody recommended the movie to me, so I saw about 1/3 of it this morning. Interesting movie.
So Mr. Blackman, do we end the forum here or do we leave it
Well,
open?
yeah, if no one has any further questions or further comments, yeah, right. So what we could probably do, since we're leaving early, I'll have a chat with the team after, and maybe we might start the movie a little earlier than we were planning to. So we will post that in the members chat. All right. So you all look out to the members chat, the members forum, and we'll post the information there. Okay.
Just a reminder, I could go ahead and remind them, Kieran, about tomorrow's events.
Yeah, well, we're having a caregiver forum in the morning as well, right? So we will reach out to the caregivers, and we will post for those who are interested in viewing and joining the session. We will post that information in the members group as well. All right, and then remember, tomorrow we have our main event, for World Sickle Cell Day, the inaugural Dr. Waveney Charles distinguished lecture. We have Professor Odegongong Olayami, Olayemi, sorry, from the University of Ghana, speaking on sickle cell. And we also have a panel discussion after with Professor Odame from Canada, Professor Asnani from Jamaica, and Dr. Kenneth Charles. All right, so look forward to that tomorrow evening.
You will be posting that on Facebook, right?
Yeah, yeah, most likely, yes. Yeah, that one will be live on Facebook.
Okay.
Okay, folks, so if anyone else has no further interaction, Mr. Sandy, thank you very, very much for your time. This, it was very informative, it was very helpful, right? One thing I want to ask, I know we have different, within the society, we have different types of families, and for those persons who are seeking help and may not necessarily be able to afford financially afford the help, what is available there to them that they can access?
All right. So the Ministry of Education has, not Ministry of Education, Ministry of Health has, at least last time I checked, they have a very detailed public list of mental health services that they can access if you're specifically referring to mental health. So it should be, I could always probably just Google it and probably post the link as well to that. But yeah, they have that. Professor Hutchinson has brought out some, I think at least 2 stress clinics across the East-West corridor. I think that's really
yes.
Yeah. So those are places that they can access free help, mental health as well.
So, but in terms of family counseling and stuff, that is available as well, like family counseling and things like that.
I'm not too sure about the family counseling, especially when it pertains to the stress clinic, but there may be avenues for that listed in the Ministry of Health's sources page.
Okay. All right, thank you for that. Well, thank you very much for your time, sir, and it was a very interesting, very informative